The annual enrollment period for Medicare is already underway and will end December 7th. That means lots of folks are currently signing up for Medicare, and according to experts, that means lots of folks are making some common enrollment mistakes. And to learn about these mistakes and how best to avoid them, we welcome Dr. Leo Odle with Optum Arizona. Good to have you here. Thanks for joining us.
Thanks for having me.
The annual enrollment period, October 15th through December 7th, and a general enrollment period from January for. Why are there even dates on this? Why are there deadlines?
It's government. If you don't put deadlines on things, people don't get things done. You do need to sign up for your insurance plan and decide it so they can budget appropriately.
If you're over 65, you do not need to enroll in Medicare. It's a good idea, but you don't need to enroll in Medicare, correct?
You do need to enroll in Medicare. You do need to notify them that you're going to enroll in Medicare. If you're still working at 65, you may not want to enroll in Medicare.
Okay, but if you're still working and you don't need the Medicare, do you still need to notify them?
I believe that you do. Yes.
Okay. For those under the age of 65, who qualifies for Medicare?
People who are disabled, people with special medical diagnosis, transplant patients will qualify for it as well, and generally disabled people.
All right, you've got these 5 mistakes for those to do enroll in Medicare. So let's get to number 1, and that is don't let the automatic plan renewal make that choice for you. What does that mean?
Automatic renewal is exactly what it sounds. Your insurance company sends you a notice, hey, we're putting you in the same plan next year. The problem with that is that your health care might have changed year to year. That same plan that you're in this year might not be appropriate for you next year. You do need to look at that very closely.
Okay, so and just general circumstances, correct?
Absolutely.
Yeah. All right, number 2 is don't ignore your annual notice of change. Kind of similar to number 1.
It is similar. The first one is you changing in your health care with your annual renewal, automatic renewal. The annual notice of change, you notice the word annual in there, it comes every year. The insurance companies will change what they're going to cover and their benefits and their general conditions of their plan every year. And you need to read that. Just because your plan was great this year doesn't mean it's going to be great next year. It might change for you.
How much will it change? Can it change significantly?
It's changing very significantly this year with the prescription drug benefit. We're going away from this donut hole madness to a much more $2,000 max out of pocket.
Okay, so again, if it impacts budget, if it impacts health care, you got to be aware of it, keep on top of it.
Keep on top of it.
And folks don't do that, do they?
They don't. They get lazy and they're happy with their plan, and then the things change on them, their own health changes, their plan changes, and then they're no longer happy.
Folks are also price conscious, and your mistake number 3 is don't base your plan on premium alone. You get what you pay for here?
Absolutely. You may look at that and say, this is the best plan for me. This one's going to give me better dental, but now you're paying more for your prescription drug benefit, or you're paying more for your specialist, or you're paying more for your primary care. You need to look at you as an individual and what your needs are and talk to an insurance specialist and advisor.
When you talk about specialists, I mean, things like routine vision and dental, that you got to be aware what's there and what's not.
You can get routine vision and dental in some plans, absolutely. In other plans you can't, but you might get better prescription drug coverage with those.
And out-of-pocket costs can, again, be significant.
They absolutely can be.
And when people do sign up for Medicare, how do they figure out whether the out-of-pocket costs have changed?
That's above me. You need to really talk to an advisor, and they have computer advisors online that can help you. You enter your physicians in there, your health concerns, your medications, and it can tell you which plan is going to work best for you. I like people. I would encourage you to talk to an insurance specialist.
Okay, what about talking to your neighbor, your best friend, your cousin, your uncle, and they say, I've got this. What about that idea?
You and your neighbor have different health concerns. You take different medications. You have different doctors. And even with your spouse, a lot of people think, well, my spouse has this plan, I have to have this plan. That's not true. You can have different plans because you're different people.
So, with that in mind, and you kind of referred to this earlier, but what do you look at? Give me a top 3. Is it price? Is it options? What do you look at?
I think you look at your coverage, what you need. Do you need specialist coverage? You need to look at which doctors are network for you. If you're in the middle of chemotherapy, you don't want to change doctors. You want to make sure you're continuing with those doctors that you're getting treatment from. You want to make sure your primary care doctor is there, your quarterback of your healthcare team is there. You want to make sure that your medications are covered. And I've seen this a lot where people sign up for one plan and their old plan covered it, but their new plan doesn't.
Interesting. All right, number 5 here, the common mistakes, 5 common mistakes of Medicare enrollees. Don't assume that you don't qualify for help with Medicare costs?
There are several programs out there, federal and state, that can help you pay for, in particular, medications. And they're usually based on need, on financial need. Some of them are based on health, your health status, but making sure you look at those. Some of those thresholds aren't that low. You might make them and not think that you could.
Okay, how do you know this? I mean, is there a formula? Is there a table? Is there
There are formulas and there are tables, and again, an advisor, someone who is really equipped. It changes so much every year. These people take classes in this to learn this every year.
And that's what I was going to ask you. I mean, it just seems as though it can be really confusing if you're not Dr. Odle here. I mean, we don't spend our entire, our 24/7 here in the medical industry and with Medicare. It can be overwhelming.
Very much so. And especially if you're a senior and you're not computer savvy, your vision may not be as well, so you're not reading the pamphlets as well as they come in. The print can be very small. Getting help with that is a big deal.
And then we're not even mentioning Medicare Advantage, Part D, all these other aspects that can add to the confusion.
Absolutely. Medicare Advantage, Medicare Part D, traditional Medicare, they all have different flavors of problems you can encounter.
Medicare, by the way, for those who aren't familiar, what is Medicare Advantage?
Medicare Advantage is a comprehensive plan where you are assigned to a primary care doctor who manages your care through the healthcare system. They give you a lot of structure and guidance, and they help you get to the best healthcare you can get.
Who's best suited for it? For Medicare Advantage?
Anyone who wants to get into it. It's lower cost for you. You get Medicare professionals, you get a team of doctors, you get a primary care doctor who's going to help you guide you through it.
Okay, so it's just basically your situation. It's kind of hard to give a generality as to who would benefit more than others.
I think really any senior can benefit from it, but especially if you have a lot of healthcare needs. We can really help you with that.
So Medicare Advantage would be kind of something to look into.
Yes.
All right, Dr. Leo Odle, Optum Arizona, the 5 common mistakes of enrollees into Medicare. Thank you so much.
Thank you.